Every year, thousands of people hear the words, "You have a brain tumor." And almost immediately, two questions follow. Can you take it out? And will chemo help? The truth is, treating a brain tumor isn't just about killing cancer cells. It's about doing it without harming the most complex organ we have, the brain itself. Today, let's explore how doctors combine surgery and chemotherapy to achieve this delicate balance. Surgery is almost always the first line of defense. The goal is simple, but the execution is incredibly complex. Remove as much of the tumor as possible without damaging the parts of the brain that control movement, speech, or memory. Think of it as disarming a bomb while it's still ticking. To do this, surgeons have some amazing technology at their disposal. Imagine taking an MRI scan during the surgery. That's exactly what intraoperative MRI does. It gives surgeons real-time images, allowing them to check if any tumor tissue has been left behind before they even close up. Then there are neuronavigation systems, which act like a GPS for the brain. Using pre-op scans, they create a detailed 3D map, showing the surgeon the safest route to the tumor, avoiding critical areas. Sometimes the best way to protect brain function is to have the patient help out. In what's called an awake craniotomy, the patient is woken up during the operation. It sounds scary, but it's completely safe. As the surgeon gently stimulates parts of the brain, the patient might be asked to talk or move their hands. This lets the surgical team know exactly which areas are essential and must be preserved. And for an extra layer of precision, surgeons can use fluorescence-guided surgery. The patient is given a special dye before the operation. Under a blue light, the tumor cells glow bright pink, making even the tiniest cancerous specks, normally invisible to the naked eye, stand out for removal. If a tumor is easy to reach and clearly defined, like a meningioma, surgery can often remove it completely. But for tumors that are deep inside the brain or have tendrils spreading into healthy tissue, like a glioblastoma, total removal is impossible. That's when the battle shifts and chemotherapy enters the fight. Chemotherapy for brain tumors has a major hurdle to overcome: the blood-brain barrier. This is a natural protective shield that keeps toxins out of our brain. The problem? It also blocks most chemo drugs. To get past this defense, doctors use special drugs that are small enough to cross the barrier. The most common one is temozolomide, or TMZ. It works by damaging the DNA of cancer cells, stopping them from multiplying. Often, chemo is combined with radiation in a 1-2 punch known as the STUP protocol, especially for glioblastomas. Patients receive daily radiation alongside temozolomide, followed by several more cycles of the drug. In some cases, surgeons can even place tiny dissolvable wafers soaked in chemotherapy, like carmustine, directly into the space where the tumor was removed. This delivers a powerful, localized dose right where it's needed most, with fewer side effects. So, surgery removes what can be seen. Chemotherapy targets what's invisible. Together, they form our strongest defense against one of medicine's greatest challenges. While we can't cure every brain tumor yet, every millimeter removed in surgery, and every cycle of chemo completed is a step towards a longer, better life. If you found this video helpful, please give it a thumbs up and subscribe for more medical topics explained simply.